Diabetes, medically known as diabetes mellitus, occurs when the level of sugar or glucose in the blood becomes higher than normal. There are two main types of diabetes: type 1 diabetes and type 2 diabetes. In the UK, about 1 in 300 people develop type 1 diabetes at some point in their life. This used to be known as juvenile, early onset or insulin-dependent diabetes. It usually first develops in childhood or in young adulthood. In most cases, type 1 diabetes is a result of a disease in your immune system, the system in your body that fights disease. It mistakenly attacks the cells in your pancreas called beta cells that are responsible for making insulin. With type 1 diabetes, the illness usually develops quite quickly, over days or weeks, as the pancreas stops making insulin. It is treated with insulin by injections or a pocket-sized pump, along with a healthy lifestyle.
Type 2 diabetes is much more common than type 1 diabetes and is on the increase. It tends to run in families and in certain ethnic groups, and is more common as people get older. It is around 5 times more common in South Asian and African Caribbean people, often being found before the age of 40. It is estimated that there are around 750,000 people in the UK with type 2 diabetes who have not yet been diagnosed with the condition. Harrow has a large South Asian population, and so diabetes is a particular issue in our borough. The proportion of our population with diabetes is higher in Harrow than any London borough. 8.5% of the adult population have diabetes, about 16,000 people. But the true rate of diabetes in Harrow is probably closer to 10%, another 2,800 people. And over the next 20 years, these figures are likely to increase by 45%. There is a threefold increased risk of diabetes among people of South Asian origin compared with white people, and risk increases at a younger age. The risk of diabetes-related complications for angina and heart failure are higher in Harrow than the England average. The NHS currently spends £14 billion a year on diabetes, and 80% of this spending is on the treatment of preventable complications.
You need to watch out for these 3 key symptoms which could mean type 1 or type 2 diabetes. You are thirsty a lot of the time, you pass a lot of water, tiredness, weight loss, and feeling generally unwell. These symptoms may develop quite quickly, over a few days or weeks, but as soon as you notice them, going to see your GP is important. The best way to know for sure is to have a blood test to check the level of sugar in your blood. Diabetes is a serious disease. If left untreated, you can even lapse into a coma and die, but it is preventable if diabetes is diagnosed and treated early to prevent long-term complications, which can include angina, heart attacks, and stroke. Whilst these complications are not inevitable, they are often linked to type 2 diabetes, which has been undiagnosed for a long time, and in any type of diabetes that has not been effectively treated or attended to. So taking diabetes seriously from the very start is a good way to prevent these problems.